Hello, so excited to be with you again today. Over the last, couple days, we've been talking about managing the symptoms of peripheral neuropathy. We started with the Gibson method and explaining what the Gibson method was, and then we talked about yesterday nerve pain. And one of the common ways that we actually treat or improve or manage nerve pain is through a situation called nerve re-education. There are 4 ways that you can actually treat or help improve nerve functioning. One of those is nerve re-education. Through nerve re-education, what you're doing is taking a nerve that is malfunctioning in such a way that it's sending signals incorrectly, and we're actually giving it or improving its education, helping it to function more like it's supposed to. So how does that work? The idea is you've got a nerve that's sending a signal, and that signal is either weak or is being sent in such a way that the brain can't understand it. And so through nerve re-education, what you're doing is teaching the nerve to send the signal the correct way it's supposed to. One of the machines that we use to do that is called Calmare, which we will talk about here in a couple days. But the Calmare machine, what it does is it sends it through a sequence of electrical currents that is realigning and helping the function of that nerve so it understands the correct signal process. It's also re-educating the brain to recognize the signals, what signals are normal and what signals aren't. So through re-education, you're actually helping the nerve, instead of sending the wrong signals to the brain, it's actually sending correct signals that the brain can recognize and the brain can use. So let's give an example. So if you had significant nerve pain at night and you're saying, okay, when I get in bed and I pull the sheets up over my feet, the pressure of the sheets causes significant pain. And that's because the signal of touch is being sent to the brain as pain, or as something that the brain doesn't recognize, so it interprets it as pain. So through nerve re-education, what you're doing is getting so that it's starting to recognize that touch of the ground is normal. Touch of a sheet on the feet is normal. And in some of this numbness, tingling, electrical shocks, and even the sharp pains that come with certain types of peripheral neuropathy will improve, and the touch on the ground now feels like touching the ground. Or you will lose the numbness. You won't have the numbness and tingling anymore. You'll actually have normal sensation. And because of that nerve re-education, you're actually starting to function like you're supposed to. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 12. Again, nerve re-education. It is the first of 4 ways that we actually can improve nerve symptoms, or manage nerve symptoms in this case. So nerve